Statistics tell us that unfortunately, many kids with disabilities will also face mental health challenges. So we sat down with clinical director and founder of CARE LA, Dr. Lauren Stutman, and discussed the intersectionality between disability and mental health in children.
So are kids with developmental disabilities or disorders, are they a vulnerable population when it comes to mental health?
Absolutely. And there's a number of studies that show it's not a question. They're definitely a vulnerable population. There's a lot of reasons why. One is less access to specialists, mental health specialists that understand the lived experience. Another reason is being othered and being isolated. Social connection is such a protective factor for mental health. So that's an issue. Also, with certain illnesses, there's chronic pain or a change in diet, or there's missed school, problems with schoolwork. So there's just so many more reasons why these kids are actually a vulnerable population.
Right. And are there common co-occurring diagnoses between mental health and disabilities?
With autism spectrum disorder, there's comorbidity with ADHD. And also, having ADHD does put a child at a higher risk of attempting suicide because of the impulsivity involved. And then all of the more comorbidities someone has, the more obstacles they face for their mental health. That's just the way it is. There's something called the stress diathesis model. And what that is basically, you know how they say whatever doesn't kill you makes you stronger. But in mental health, unfortunately, the more you face, the more chances you have to have more mental health issues.
And while we're talking about diagnoses as well, is it harder for some families to get these mental health diagnoses if their kids have disabilities? I mean, essentially, also, are there biases in diagnosis?
That's a really good question. So I forgot to mention that CP, there's the biggest comorbidity there is anxiety.
Oh.
So the issue is when kids have a disability that's very clear, what happens is the doctors or the professionals, they tend to see the child through the lens of that disability. So for autism, a lot of the kids who were diagnosed with autism did not get the comorbidity diagnosis of anxiety, even though they tested for anxiety, because the doctors would just attribute it to the autism.
Right. Mm-hmm.
Also with ADHD, that was the case.
And I was going to say, I think you can go for a lot of diagnoses with that. It's, kids with multiple disabilities can also go in and they're having these issues, but it's sort of written off. It oftentimes feels like, well, of course there's going to be issues. You're not going to sleep well. You're going to be anxious. Well, of course. And they are.
Yeah, and it's like, and we're not going to treat that.
Exactly.
And then another issue is that I think a lot of doctors don't want to pile on the diagnoses for fear that it's going to overwhelm the parent or the child. So it's like, we've already given this and this and this, and we don't want to keep piling it on, but it's still important for the child's story and for their treatment. Kids with ASD, autism spectrum, they have also a higher incidence of developing anxiety, and that is what is overlooked because of bias.
Specifically with autism, what about boys and girls? Do you see any difference in mental health?
Yeah, we do. We see a lot of difference, but I think that people are starting to get on board with how to identify girls. I think the tests are skewed for the boys to get the diagnosis because in our society, we teach girls, we gender girls to have more, to be more considerate for other people, to be more caring. So what happens is they are able to mask. And because of that, they don't get the diagnosis.
And some people think this is an obvious answer, but should parents seek a mental health diagnosis for their child? And I would love for you to, state the pros and cons, because there are a lot of families who don't want that stigma, and I say that in quotes. So I would love your take on that.
I am very pro finding out a diagnosis because I know from my personal experience growing up with undiagnosed OCD, the feeling of I'm so weird, I'm so different. Why am I thinking these thoughts? Am I going to kill my pet bird? All of these thoughts once I found out, oh no, these are intrusive thoughts because you have OCD. And it's kind of like that whole name it to tame it. You know, it puts it in a box. It makes it clear. I remember my uncle, he was having problems breathing, and he went to the doctor. He did all this testing, and then he found out he had interstitial pulmonary issues. So he told me, oh, I have interstitial pulmonary disease. And I was like, that just kind of means you have lung in between the cells, lung problems. But because he had that name, he felt like, oh, I have an answer. And I have seen so many kids come into this office, and when they actually, I let the kids have the information, let's say with autism, and they piece it together. And eventually a lot of the kids have come to me and said, do you think I have autism? And then I'll be like, what do you think? And we'll go through the list together. And I have seen it be extremely healing for most kids. I have on the cons seen it where it really impacted a couple of kids in a negative way, where they felt that they had a disease or they felt like something was wrong. But I think that's more a symptom of our society and the stigma that we place on mental health illness. For a lot of kids, what I do is I explain that they have what's called a sticky brain. And it's so good with learning. It's like a sponge. And the problem is some things stick to it too much. So you give the information in a really loving and comprehensive, healthy way, and they're going to internalize it. So it's really about the way that whoever's sharing the information shares it, because I've had a lot of kids leave the office with a big smile on their face.
And so what are some of the signs and behaviors that parents should look out for any kind of, mental health issues for their kids?
So there's some clear signs that things are going wrong. And that is any isolation that you've noticed as a difference, being weepy or withdrawn, any change in appetite, any major sleep changes, any change with friendships. So and then finally grades. If your child was bubbly and then it looks like all of a sudden the life is drained from their eyes, or if you have a child who likes hanging out in the family room and all of a sudden they're stuck in their room all the time, there's a good chance that they might need some intervention.
And when you were talking earlier about girls and masking, can that also transfer to trying to cover up, like this, trying to cover up what they're feeling, act like nothing's different?
Absolutely.
And are those sort of the signs that you went through? Do we just have to look a little harder for those? Is there anything else specific to maybe girls who are trying, or boys, right? Anyone who's sort of trying to cover it up. They don't want people to worry. They don't want people to notice anything's going on.
There has to be some sign. Parents can't, but I guess having regular talks with your child would be a good way to start, and making sure that your children feel safe explaining things to you without judgment and just listening. I have so many kids come in here, and what they want most from their parents is that they can talk and their parents will just listen without giving advice.
And I know, again, to some people, this might seem obvious, and you kind of went over some things before, but what might contribute to depression or suicidal thoughts?
Being bullied, being ousted from your group, parents that are really not getting along with one another and fighting in front of them, or stonewalling each other and not talking in front of them, where you can feel the negative interaction, even though nothing's being said. Changes, big changes, like change in school, a family member that was living with them leaving or passing away. Any of those things can really trigger it. But I would say anytime there's a major life transition, parents should be on more alert.
I would love for you to take us through some steps on how parents can support a child through a mental health crisis.
So it depends what's going on, but I would say that you would want to find out if they have any plans or any intent for how they would attempt suicide. So you would ask them, and you would find out. You'd also scan the area and find out if there's any means to do that, like looking for weapons, guns, what we call sharps, which are knives or needles, things of that nature. And if your child is expressing that they have an intent to harm themselves, you would clear away any of those things. I would definitely set up an appointment with a psychiatrist and a psychologist if possible, or any type of mental health therapist. Finally, I would make sure that my child was not isolated. So I would plan a lot of family activities, not to exhaust them, but even if it's a family movie night, checking in here and there, checking in with texts and memes, things that just let the kids know that they're not alone. Yeah, so you'd have a loving conversation. You'd try to educate them as to why they might be self-harming. You'd find out how. And then you would say that you're going to give them the help they deserve. Just like if a kid, our minds and our bodies need to be kept well. It's sad that our society doesn't have a mental health check-in, although I think some primary care doctors and pediatricians are now giving at least checklists. But so what you want to say, and what I say to parents, is that if you had, a lot of pain in your, let's say in your foot, I would take you to a podiatrist. If you had a lot of pain in your teeth, I would take you to a dentist. And if you're having a lot of big feelings like this, and you're coping with them in ways that, although they're kind of smart that you figured it out, are not a good habit to get into, then we would take you to a feelings doctor.
Does anything change when you're dealing with maybe a kiddo who's a lot younger? Is there anything?
That would just be the language, the developmental level of the language that you use, but you'd still want to get them the help they need.
Right.
And actually better in a way, because earlier intervention leads to better outcome.
What about parents who are experiencing this, who think, oh my gosh, like this doesn't ever happen with kids this young? Of course we would like that to be true, but for those parents that feel like, and I certainly don't want to talk to anyone about this because no one's going to get it, I'm the only one. I mean, what do you want to say to those?
They're absolutely not the only one. We have so many kids that are 5, 6 years old here. I know therapists that treat 3 and 4-year-olds that have no space anymore. It's, we just dealt with something that was so profound as a society, and we really need to understand that when something like that happens, mental health issues are going to arise. And another thing is that it's just not it's not the parent's fault, because that's what keeps parents from sharing. And that makes them isolated and more depressed and more stressed. And then they can't parent as well.
Right. And they're the ones that are feeling that shame. And there should not be any of that, right?
No way.
Yeah. Yeah. Are there groups where parents who are dealing with this can also get together? I mean, is this mostly dealt with at an individual level? Are there
there's tons of parenting groups. There's parenting groups for social skills groups. There's parenting groups that I believe we run a parenting group. Parenting groups are really healing. And it's so great to hear that other people are going through this with you.
And what feels like you're at, or what could be, your worst moments when you feel like no one understands this, there is always somebody out there who unfortunately, understands this. But then when you can come together again, just like your child, you can feel like you are not alone in the world dealing with this. And I guess that leads us, you've definitely psychiatrists, psychologists, but like, who should parents go to for help, and who should be on this mental health team for our children?
So I think definitely the pediatrician. If there are symptoms that the parents can't handle as far as mental health pain goes. And then if parents and the pediatrician feel that this is beyond the scope of what the parents can handle, it should go to a therapist. And if the therapist feels that this is something that is really extreme or in need of a higher level, then it will go to a psychiatrist. And then if that, treatment and medication, the outpatient treatment and medication doesn't work, or the weekly therapy, then it would bump up to like an AOP, accelerated outpatient, or an IOP, which is daily therapy for like 3 hours a day. And then if that doesn't work, then there could be partial hospitalization. And that's the con of that, is that, sometimes you'll miss school for those things, but some places allow you to be in school and then come there afterwards. And then if that fails, then you might think of a residential treatment facility, a therapeutic boarding school. There's different schooling options like Fusion Academy, where it's more individualized treatment, where you're not in school. Obviously, we want kids to be as mainstream as possible, but sometimes it's not worth the heaviness that they're experiencing to keep them in that school. And sometimes they just can't do it. And at some point, we need to be realistic about it. And sometimes, and this is really hard, you have to push your kids to where they're not comfortable. And sometimes you need to see what's not working. I heard somebody speaking the other day, and they said something like, when kids come into the room, when parents come into the room and they're talking about their child that maybe has ADHD, who's just not listening and just can't do it, or they say they can't do it, the therapist says, well, I want you to just do a backflip when you leave today. And they're like, I can't do that. And it's like, no, just do it. Can't do it. Okay, but what if we broke it down and we let you do a forward roll? So we really need to understand that some of these things are just lapses in skill and the kid is not there. And then we have to take it down, but with tiny little steps moving forward.
Absolutely. We can't judge them based on what a neurotypical child or a child without mental health issues, what they're doing, right? Like we have to do what makes sense for them, break it down and see, and progress is progress, right? We're moving forward.
I feel like a really good analogy for kids and parents is like each one of these disorders and each one of these neurodiversities comes with bricks. And the more you have, the more bricks you have piled on, and you can't hold up all these bricks. And how can you expect somebody that's holding 1,000 bricks to be completing the same race as someone who has 2 bricks? But the person who has 1,000 bricks, that could be their biggest blessing, because they get to put the bricks down and learn the tools that they need when they're young. Whereas the person with the 2 or the 10 bricks might go their whole lives holding 10 bricks. So it's just a different way to look at it.
So what are the most important questions that we should be asking our child's mental health care team? What do parents need to be focusing on?
I think that parents should learn about whatever diagnosis there is, and parents should be honest with the therapist. If they're not going to read a book, they need to tell the therapist, because it's the therapist's job to get the information to the parents. So somebody might ferociously read a book, whereas somebody else needs a video and somebody else just needs to talk to the therapist. And that's really important. So there's just, as the spin instructor says, there's no shame in that game. Like, just be honest with your child's therapist. It's important to have a team meeting. I know that sometimes that can be expensive and hard to do, but if you can, I would really push for an entire team meeting, because it helps all the pieces. Sometimes doctors see things only through their lens, but if you get the whole team together, it's going to be much more holistic, and it's really going to make a difference.
And when you say team, can you define team? Like who should parents be getting together?
The therapist, the psychiatrist. It would be really cool to get the primary care doctor, but I don't know if that's, if you have to choose, I would say the mental health team is really important.
And then when we're looking for the right person for our child, is it harder? Should we be looking for a specific professional who also has experience with kids with disabilities, specifically our child's disability, right? Because mental health professionals, it's not just like anyone. It's not, okay, great, go to anyone and they're going to be the right fit for our kiddos. Because I've heard a lot of parents who sort of back out when they go and somebody doesn't get their kid. And it's like, what do we do?
You need to feel that the therapist gets your kid. You need to ask them, have they had experience working with this population? And you'll know, because at this point, the parents are going to be really savvy, or more savvy than any therapist who doesn't know. Right. So if there's red flags, if they don't know a major term, if you go to a therapist for OCD and they don't know the term ERP, that's a big red flag. Because I've seen kids that had OCD and the therapist thought that they were delusional and thought that they were dangerous because they had harm OCD. And so it's really important that a therapist knows what they're doing when they're working with a vulnerable child. And you also want to make sure that you hear words like neurodiverse affirming.
Right.
because that's really important. A lot of people have been pro teaching kids about masking, and now we're trying to be more accommodating to their actual personality and their comforts. So that's important to find out, what's your role with that. I would say definitely ask about the specifics, and if they can talk on it, that's great. If there's a mention on the website about it, that's a good sign. People on a website that have everything listed as a specialty is a red flag. So you really need to look into who this professional is. Do you know anybody who's also worked with them? Things of that nature. If you just also get a gut feeling that it's not right, I would stick with that.
Absolutely.
And also, if you are looking for a certain type of specialist and it's really hard to find it in your insurance, you can reach out to your insurance, and I'm sure you know this better than me, and they can make an exception to pay an out-of-network provider.
How can families develop like positive coping strategies for their kids? So we're teaching them, a strength-based lens, talking to them about what they're, about their challenges, not taking away from that and saying everything's great. We're hearing them, we're that safe space. And then how do we then teach them to not cut themselves, right? To think not so negatively about themselves, to take that shame. How do we move to the positive side?
Teach them about their neurotype, or, the way that they see the world in the positive lens, and how they can make changes if they want to. We don't want to put pressure on them to change the world, right. But then what we would want to do is meet them where they're at. Like, where is your challenge? What you want to do is you want to have them learn how to be mindful of what were you feeling right when this happened. And a therapist or you might need to teach them about feelings first, because a lot of kids, especially kids with autism, might not know what they're feeling. So then you would do that, and then you would have them just become mindful, aware of when are you feeling this way, and what are you thinking? What can you say to yourself? And then to replace the behavior. So instead of cutting, what if you take a lemon and bite into it? Because that is like the gate theory of pain. That's going to take all your attention and bring it to the sourness of the lemon. Or you could take a cold shower, and that's going to activate the fight or flight. And when you shut the cold water, it tricks your brain like a brain hack and activates the parasympathetic nervous system, which is where the relaxation response resides. So there's like all these different tricks: taking a 4-7-8 breath, drawing, calling a friend. So what I like to do is have them write down all of these and then put it in a box, or if they're older, put it on their phone with a list. And then they go through each and see what helps.
I love that. Can I ask you about what about, just because we've sort of touched on OCD, positive coping strategies for OCD, like what would you tell, how should we teach our kids?
So for OCD, what you'd want to do is recognize the intrusive thought, and you would say, like, there's that thought again. So you separate yourself from the thought. And then you might develop a hierarchy for exposure where you would delay the compulsion. And then you would change it up. You would do the compulsion in reverse order. And then eventually you would delay it further until you stop doing the compulsion on purpose, or you replace it, you redirect.
Is there another major one, anxieties or anything else?
For depression, a major coping strategy is behavioral activation. So that's really where you do the opposite, basically, of what you want. So if you want to sit in your bed, you do the opposite. You take a shower and you make plans and you go out. So we don't want to accommodate for anxiety, for OCD, or for depression too much, where we let the depression, anxiety, or OCD take charge and dictate what we do. Sometimes we want to do the opposite of what feels right. So teaching kids about that and how that kickstarts certain neurotransmitters, dopamine, serotonin, if you're connecting oxytocin, all those things are going to fight against the depression. I think that a lot of times doctors, especially psychologists, don't really touch on things other than the psychological, and movement is really psychological. It's really important that our kids are getting exercise, especially if they're suffering with a mental illness. Also, changing the setting is really good for almost anything, for addiction, for depression, for anxiety, just change the setting, go somewhere else, go take a walk, go in the other room.
And we've talked about a lot of amazing strategies, and I don't think we've touched on, and something that, some parents really want to embrace and some it makes them very nervous, and that's medication. And so when should parents, and I know, you're not a psychiatrist, but like when should families think about medication?
Well, I think if any child is expressing suicidality, is a good time to just get, I say just, but it's hard to find a psychiatrist. So I think it's even good to start when you hear this, because you might be on a wait list. But to get an evaluation is really important, just to rule out that a higher level of care is needed. I think that parents have this stigmatized understanding of medication that is so harmful. I've had so many kids come in that have suffered for years, and then I've been fired by some families, and then they've come back to me and said, yeah, you know what, we're ready for this. And I've had teenagers tell me, oh my God, this has changed my whole life, and if only I would have done this sooner. It's not a failure. And in fact, if a child is dealing with a major stressor for years on end, that's activating their fight or flight, that's activating cortisol, and that's activating adrenaline. And those, when they're in high quantities for long enough, are a neurotoxin. So you really have to understand that if you don't medicate your child, they are getting chemicals that aren't the natural chemicals for the developing brain.
I guess going back to the stigma question too, of parents feeling, like you said, a lot of might think this is a failure, or I'm going to make them a zombie, or I don't want my kid to be on medication, right? No, but nobody was on medication when I was growing up. Like, this feels really, like a drastic step, right?
Well, I think that the therapists or the psychiatrists have to really build a trust with the parents, explain it, maybe find other parents who also felt that way, who saw the benefits of it. I'm not pro rah medication. I think there's so many different avenues first, but if things are serious, or if the suffering has gone on and the other interventions have not worked, medication is a very viable therapy. And then also, it's really important for parents to understand that they don't need to share their information with everybody. It's private information. And if somebody's saying something that's hurting you, you can shut it down, because they're not psychologists. They're not therapists. They have no right to tell you about that. And if your kid had diabetes or a seizure disorder, you would give them the medication, no question, for most people.
Right.
So why is mental health something different? Just because it's invisible doesn't mean that it's not really happening.
What would you say are the 3 most important tips for parents navigating mental health for their kids?
I think don't settle for somebody that feels wrong. Model that this is normal and healthy to seek mental health, and then learn about your child's disorder or diagnosis. Learn about it in any way that feels, okay for you, and then model how you accept your child fully. And I would say also pay attention to your own stress levels, your own mental health issues, and practice what we want our children to do.